estrogen and migraines.
Ooh, can I have a picture?
Ooh.
Can I get
Yes,
your
please.
favorite thing?
Back to the pics.
Yes, nerdy Dr. Men with her pictures.
I love
All
it.
right, so this is one of the most common things we see in perimenopause. So I have a picture for you guys because I want women to understand what's happening to their bodies. So I want you to focus on the top part of this graph, okay? So let's just talk through it so everyone understands what they're seeing. So on the bottom, so like basically they're starting at day one here, basically your menstrual cycle, right?
Right.
The blue is estrogen. So let's just remember, like the beginning of your menstrual cycle, estrogen is lower, it starts to spike, and then you ovulate right around here, right? So see day 14, you would ovulate right around here. And the orange line is progesterone. And in the second half of your menstrual cycle, you've got another bump of estrogen in the progesterone. So on the top, this top picture is what's showing is when women get menstrual migraines, right? So this can happen way before perimenopause. It happens to teenagers even, right?
Sure.
So for women in general, so hormonally associated migraines or menstrual migraines, the classic thing is a patient comes in and is like, yep, I have pretty regular periods. And right before I bleed, or the first couple of days of bleeding, my migraine, I get a trigger and headaches. Why is that happening? This is the highest migraine susceptibility window when women are still cycling, menstrual migraines. And you can see when it happens. So day 27 or 28, this means right before you get your period. And that's when all the hormone levels, boom, drop.
Yeah.
Or in days 1, 2, or 3, the beginning days of bleeding. Why? This is when your estrogen levels are lowest, and this is when there's been a dramatic drop. Remember, your brain is really sensitive to the changes in the hormones. So when it comes to migraines, it's this instability. Okay, so now look at the bottom picture. This is just showing from age 0 to age 80, all right? And so here, like you see around, your teenage years, your estrogen levels obviously are going up, right? So it's just kind of basically showing that, all right, you've got all these years with normal, regular estrogen production. So it's in the years age 45 to 55, roughly. So like those perimenopause, menopause transition, when you have erratic estrogen, that in the neurology literature, and when they've looked at this in studies, this is the age of the highest migraine susceptibility. Because not only are you having this can happen at the end of menstrual cycles, you're having all of this irregularity. So one other picture here. This is a beautiful picture. So estrogen withdrawal and menstrual migraines, right? And so the estrogen withdrawal, this is just another beautiful picture showing the lining is shedding. This is the end of your cycle. Estrogen withdrawal, estrogen's going away, right? This little like light pink, like little bar here, this shows this is the time of susceptibility. So how do we manage this in perimenopause? There's a bunch of ways we can do this. If you have a migraine with aura, you are often told you cannot use an oral birth control pill that contains estrogen. That's not necessarily true. Newer data and newer recommendations actually say that an oral continuous birth control pill is actually profoundly safer than we previously thought. So if you don't have aura, we often give you a continuous birth control pill so that we never have this dip here and it's being stable. So that's one way to manage it. If you have an aura, traditionally I alluded to, we've been discouraged from using synthetic birth control pills because it could raise the risk of blood clot and stroke, okay, in women who have bad migraines with aura. So what do we do then? So what we can do, if we decided we don't feel good about using a birth control pill, although sometimes we can, what we can do is women who have these migraines, they know exactly when they're going to happen. It happens like clockwork. So this is where I've found my Evamist or other MHT to be really helpful. So we may, cycle you with progesterone or, give you estrogen during the rest of the month if you have other menopausal symptoms. But if you tell me that this is when your migraines are triggered, this is when we can give you your estrogen then. So I'll tell women, okay, you're using 1 dose of Evamist during the month. Well, when you get really close to those days where your migraines are going to kick in, give yourself 2 or 3 sprays, kind of beat it to the punch because it's really that withdrawal. For other women, a stable dose of a patch can be super helpful so that they never have that dip. So there's a number of ways that we can kind of play with this hormonally. again, there's a little bit of an art and science to it, but I hope this kind of makes sense.
Very helpful.
How it's
Yeah.
it's really an estrogen withdrawal, and there's a number of ways to manage it. I mean, certainly migraine medications are helpful, but they're not helpful if we're not getting to the root of the problem, which is estrogen withdrawal.